We don't take lightly your role in this conversation as parents who birthed a preemie, who know a preemie, who provide services for preemie, and for some of us who lost a preemie. Our voices, our lived experiences, our journeys will all now at least be reflected and or considered as we continue to expand our state's maternal health strategic plan.
We have been leading at the Department of Human Services an effort to put together a very forward-looking maternal health strategic plan. Most importantly in that work is hearing the voices of the people that we are hoping to serve.
The hospital regulations are 40 years old. And we are currently working on rewriting those hospital regulations. And so input like this from hearing what you all have to say can impact those regulatory changes that we're working on as well.
What more can we do for whole person care? And hear how we can have insurance work better for you.
There were challenges there with some nurses. Just more empathy would have been nice, and not to be so disregarded.
Was there anybody like a doula-like person?
From a system level, there has to be some intervention, because even with me being president, while I did contribute, there's still work that has to be done.
Ms. Essence had access to Naisha through a research study, but certainly showed us how much more room there was for providers like Naisha to support mothers like Essence, because it's certainly not standard of care yet for our NICU mothers to have access to support systems like doulas.
It's nice that we're getting this workforce development going, but where is the consistency making sure that they have sustainable work? If you don't have the passion as a doula, majority of the doulas that are coming in now are already working 2 and 3 other jobs.
Compassion is so vitally important, and I think that was the one thing that I really had that a lot of other parents don't necessarily have. That is definitely something that needs to be trained.
The medical team members are so focused on getting the baby healthy, getting the baby home, and there's that gap. There's only so much that the medical providers can give. And so figuring out how those partnerships with community-based organizations who are really focused on filling that gap is so key.
I want to make it abundantly clear that as a NICU nurse, and I see these families, it's the Black and the brown parents who are struggling the most. Their kids are struggling the most because they're not being heard.
We know that racial concordance improves outcomes. And so Black and brown babies are faced with NICU admissions more than any other race. What are we doing to help to increase the presence of racial concordance in healthcare? That's huge.
Accountability. You don't have these issues with how people treat people when accountability is in place.
We sit in a commonwealth where our governor, our state legislators, our state commissioners, our state representatives, and elected officials at the city level support and care about this work. So let's keep this conversation going and come back together again with a concrete set of recommendations that can help inform our state's very first maternal strategic plan. Guys, this is the first time that I've been invited to a conversation like this where leadership at the state level wants to hear from us. So usually it's the other way around. We come and we listen to what the plans and what the strategies are, and we can think about ways or find ways to advocate for our needs on the back end. Right now, we're in the driver's seat.